that screening aren't just a routine. They can be life-saving. And I hope that opening about my journey and the information that you will be receiving today, you can encourage to make your health a priority, to get screened and to act rather now than later. I am proud to be here with Dr. Stephanie Alimena. I want to welcome you to our webinar, and I'm excited to understand more about screening and early detection. And we're ready to start. Welcome, everyone.
Thank you so much, Karla. I'm excited to be here with you too. And thanks for sharing your story. It's really so important to hear from survivors and hear from folks who have been through this. And your story is super inspiring to the community. So thanks for sharing that.
Thank you. I have so many questions for you.
No problem.
Well, as we know that HPV is one of the causes of cervical cancer, could you explain how it is related to cervical cancer and why understanding this is so important to us?
Yeah, absolutely. For many years, we knew cervical cancer was a thing, but we didn't understand the cause until about the 1980s, which is kind of incredible to think about the history of this and how quickly our understanding has changed. We realized in the 80s that this virus, called the human papilloma virus, which is transmitted sexually, is the cause of over 95% of cervical cancer, so the vast majority. This virus, about 80% of people will have it at least transiently or temporarily in their lifespan. In most folks, the virus can be cleared with a normal, healthy immune system. But for certain folks, the virus might stick around longer and could create precancerous or even cancerous changes on the cervix. And it does that by altering the cells in the cervix, which is the very bottom part of the uterus, just to remind everyone, and causing changes in the DNA, the cellular mechanisms that make the cells what they are, and causing cancers to form with time, with years and years of time.
It's amazing how one small cell can do so much, right, in the body. What tests are available for cervical cancer screening?
Yeah, so this has evolved as well. The PAP test, or Papa-Nicolau test, was kind of the first screening test that was developed. And this is something we continue doing today. And that's one way to look at the cells on the cervix and see if they look abnormal. And we'll talk more about how that's done throughout this webinar. Another test that can be done is an HPV test, actually, looking to see, do the cells on the cervix have HPV around them or in them, right? And the last test is kind of a combination of the two. So we can send both tests at the same time off the same swab. And we eventually will move to a system where we're really looking at the HPV test first and looking at the cells later, but we'll get into all of those nitty-gritty details. So a number of different ways to look at it and look for cancer.
How could we distinguish the difference between an HPV and a PAP test?
Yeah, it's a good question. They're collected in the same way and usually at the same time. So typically when you get this testing done, you see a healthcare provider who inserts a small tool called a speculum into the vagina. And it helps to separate the vaginal wall so we can see the cervix, which kind of looks like a little miniature donut at the base of the vagina, essentially. And using a small spatula, plastic spatula, which generally doesn't hurt, and a little baby kind of brush, we can collect cells from the cervix. And with both of those swabs, we can do both tests, actually. So we can look at the cells under a microscope and see if they look abnormal or look like precancer or potentially even cancer. And then we can also send a separate HPV test where the lab looks for those signatures of HPV being in the cells.
And what specific factors do these tests look for in cervical cancer screening?
Yeah, so in terms of the PAP part of things, looking at the cells, you can have a number of different results. The pathologist, when they look under the microscope at the cells, they could say, wow, these look completely normal. You can also see slightly atypical cells or even low-grade changes. And they can even tell things like there's a high-grade change or potential for a precancer or cancer. So many different results you can get of varying degrees of concern for a process like a precancer or cancer going on. The HPV test in general, there are 100 different types of HPV, actually. Most of them are fairly well behaved and tend not to cause precancers and cancers. In particular, there's about 15 high-risk types that we care about and that are more prone to causing cancers and precancers. And that's what that HPV looks for, those 15 or so types. You can also have a particular type of test that tells you if you have two of the most concerning types of HPV, number 16 and number 18. Those two types alone account for about 70% of the cervical cancers and precancers we see worldwide. So there's a lot of different nuances that those tests can tell you and tell you about your risk for having a precancer or cancer.
That's interesting. I always have this question in Honduras. We don't have the phrase co-testing, but I I would really like to understand what it means and why is it more effective than using just the individual test.
It's a great question. So we used to, many years ago, just do a pap test because that's all we kind of knew how to look for cervical cancer changes. And then once we discovered HPV and started testing for it, researchers realized having an HPV virus and having it persistently is actually even more predictive of a precancer being in the cervix than just the cells themselves. So what a co-test means is that we're testing the cells and the HPV at the same time. The lab is running both tests no matter what at the same time. And it is a little bit more sensitive for picking up more precancers and cancers, as a screening test, as kind of a quick way to tell, is this someone who's in a high risk category for precancer or not? And we'll talk about kind of next steps for abnormal tests in shortly. Yeah.
One thing that I think has been being commented on recently is self-collection, and I'm very excited about it. How does self-collection compare to the traditional test methods?
Yeah, it's a great question. This is something that's actively undergoing a lot of research. They're doing kind of national studies about it. And it's a really promising way that we hope that access to screening is going to reach more people, right? One of the worst parts about doing the screening is the pelvic exam, right? It's a highly sensitive area of the body. It's an uncomfortable exam. It's a private part, right? That we're not used to showing people, right? And even in a doctor's office setting, it's uncomfortable. And for folks who have perhaps a history of trauma or particular difficulty with those exams, either due to anatomy or prior experiences, it's a big detractor from wanting to get this testing. And we completely understand that as healthcare providers. So my hope would be when we learn a little more about self-testing and as this comes down the line, we can get people doing this testing potentially even in their own homes, right? Right now, self-testing is approved by the FDA, or kind of the governing body that helps us approve testing modalities. It's only right now approved for self-testing in a healthcare setting, which means you don't have to be supervised by a doctor, but perhaps in the restroom or in an exam room by yourself, you can self-collect a swab. And it's done in a number of different ways. There's a couple of different types of self-collection tests, but in general, it's putting a small spatula or small swab into the vagina and collecting some of the cells there by yourself, right? And you would be coached by a healthcare provider about how to do this. You wouldn't just be kind of left high and dry. The reason I say we haven't completely moved to that system is it's part of a new testing system that's coming down the line where we will test for HPV first. And then if the HPV test is positive, then we would run the pap smear, the cells, right? So a little different from the co-testing where they're both sent. And this primary HPV screening is what it's called, has not been rolled out in every single health center in the United States. So this may be an option to you, self-collection, and I encourage you all to talk to your healthcare providers about if that's a possibility in your specific healthcare center. But this is something that's been going on, self-collection, in many other countries for a long time, and we are still sort of having that evolution in the United States and learning about it and getting systems in place to do this properly.
I find that self-collection is such an advantage for rural settings. Living in areas that are rural, far away from going to doctors that you have to travel 2 to 3 hours. This could be like an option, a great option to have.
Absolutely. And I think we just need to make sure, what's the system in place so that if someone collects something at home, how does it make its way to the lab? How do we make sure that things get processed and people get the results? So many centers might be doing this, but there are a lot of things that individual health centers have to figure out to do it effectively and get people the results and the findings that they need. Yeah.
I'm kind of excited about cell
Yeah,
collection, actually. I mean, I would wish that happens here in our country, that it's just rolls out too.
absolutely.
Um, Now we have self-tests and all these guidelines. You also mentioned about HPV testing prior to having the pap test. How does this come into the current screening recommendations?
You got it. So there are two kind of sets of guidelines, and here we're part of an American Cancer Society event. So the American Cancer Society has an excellent set of guidelines that I tend to use mostly in my clinic. And I'll briefly mention what the other set of guidelines is as well. But the American Cancer Society says we should start screening folks at the age of 25 for cervical cancer. And the main reason is cervical cancer is extremely rare in the younger population. Since this takes years and years to develop from the initial infection with HPV, like on the order of 10 to 15 years in most cases, that's why they think it's safe to start at age 25. In terms of what kind of testing, we talked about those couple of different, possible tests. In general, they recommend a co-test, meaning the PAP and the HPV run together every 5 years. Or if your center does primary HPV testing, sending the HPV test first, and if it's positive, then looking at the cells, you can do that every 5 years as well. And then they also recommend an alternative if you don't have access to HPV testing, which is pretty rare these days, doing a PAP test alone every 3 years. So generally speaking, every 3 to 5 years for screening, and usually up about until the age of 65, when the rate of cervical cancer after 65 also goes down fairly low. Just to quickly mention, in case folks have heard about the different screening guidelines, the US Preventative Services Task Force also has a set of very similar guidelines. They say that we can start at age 21 there and usually do PAP screening alone for the first decade that we're screening. And both kind of sets of guidelines are completely acceptable. Different providers might do different ones, but they both seem to work very well for cervical cancer screening.
How would you know your provider which guideline is using, or you can ask them directly how it might?
Absolutely. I think that's a great question for your healthcare provider. If you are in that kind of age 21 to 24, where the US Preventative Services says you can start screening versus the American Cancer Society says to hold off, I think that's a really great question for your provider. Would you start screening me? If so, why? Why not? Which set of guidelines do you use? I think that's a great question at any age to kind of ask your provider for clarity on what exactly they're thinking, and for knowledge about your body and what sorts of screenings you're going through.
It's interesting. I find it amazing that you can ask these questions, because sometimes when we go to a doctor, we're scared of asking questions because we don't know what's the plan, but having it, just amazing that you can do that.
Absolutely, and you should. I know it's sometimes scary and really intimidating being in the doctor's office, but it's your body, right? And so you absolutely have the right to ask those things. Yeah.
Now, we've talked about the guidelines and everything. How should we prepare for a cervical cancer screening appointment? What should we know?
Great question. So in general, unless it's a place where they're offering self-collection or self-screening, in general, I tell people to prepare for a pelvic exam, right? So if you want, a friend or a relative there with you for support, if you want someone to drive you to the appointment because, it's a sensitive exam, those sorts of things are absolutely valid. Expect that small kind of usually metal or plastic device, the speculum, to be gently inserted into the vagina. It is a little bit of, discomfort for sure, pressure, In general, it shouldn't be painful per se, but in certain folks, if it is painful or your anatomy is different, talk to your provider. You are absolutely in charge of that exam. You should never be felt like the exam is out of your control. So if you need something to stop, slow down, do something different, or stop the procedure, you absolutely have the right to tell your provider that. In general, the little swab that we use to collect the testing doesn't usually hurt. We're not doing a biopsy or anything like that. It's just collecting cells that have already naturally kind of sloughed off or fallen off of the cervix. And then usually that whole exam takes a couple of minutes at the most. The speculum's removed. In general, people don't usually have much bleeding or spotting. Occasionally, people might have a tiny bit just from manipulation. But that's generally kind of what to expect, I would say.
When, sorry, did I interrupt?
No, you're good.
Okay. Now, once we have the test, what should we ask for? I mean, there has to be questions or something because I I have to write everything down. So I want to know if there's something that I should be like prepared to ask my doctor about what's going on or what are my tests.
I think it's important to say, when am I supposed to receive my results, right?
Mhm.
So that you know about when those results should come back. And then how are you going to receive your results? Are you going to get a phone call? Is something going to come through your patient portal to explain the results? So I think it's important to ask your providers that. Each physician might have a different system. In my office, what generally happens is the testing takes about 3 weeks or so for the PAP and HPV test to return. And once it does, I usually send people a summary of what the results mean so they don't have to interpret the medical jargon that will pop up on their patient portal. I send them a summary in normal terms. The cells looked normal, or the cells were mildly abnormal, and what next steps would be if things were abnormal. But many doctors' offices might have the nurses give you a call or explain next steps that way. So I think the timing of results and the method of communication about results are important things to know for sure.
Another question, let's say that our results came out positive. How would we or what should we expect?
Absolutely. So if you have an abnormal test, in some circumstances, in a lot of circumstances, we recommend another test. And this is the difference between a screening test, which is PAP and HPV testing, and what we call a diagnostic test, right? The PAP and HPV test are kind of a quick way and generally not super invasive way to know, is there a possibility of a precancer or cancer going on? The diagnostic test is called a colposcopy if any of those results on the screening test is abnormal. And what a colposcopy is essentially looking at the cervix under a microscope and seeing if the doctor sees any abnormal cells under the microscope, in which case very small, couple millimeter size biopsies might be done to detect whether a precancer or cancer in fact is there. Really, only those biopsies can tell you 100% whether there's a precancer or cancer. So if you do get an abnormal PAP or HPV results, the first important thing to do is to take a deep breath and not to freak out, because it doesn't definitely mean you have cancer or precancer or anything like that. It means usually you need other testing or to be followed more closely to make sure nothing develops. For some very mild abnormalities, sometimes we recommend just repeat testing in a year. And for some test results, we recommend that colposcopy test. It all really depends on the combination of results that you have, and your healthcare provider should explain what they recommend for next steps too if you have an abnormal test.
Thank you. I think the important part is not to freak out. Sometimes we just
Yes,
like it gets overwhelming receiving the information, everything's just
absolutely. I think the important thing to keep in mind, 80% of people get HPV at some point in their lives. So if the HPV test is positive, you're in that 80%, you're in the 8 out of 10 people who have it. it doesn't necessarily mean something will develop. It means we have to watch and look for things. Yeah.
That's excellent. One of the things, as a personal experience, like when I found out that 8 out of 10 people had HPV, it made me feel like, okay, this is not just an isolated event, something that happens. It's so common, right?
Absolutely. I tell people it's technically a sexually transmitted infection, but it's not like the other infections that cause pain, discharge,
Mhm.
infertility, right? The main things it can cause, sometimes genital warts, but not typically, is really these kind of pap smear changes that don't cause any symptoms at all in most circumstances, unless a cancer is developed. So it's a virus. It's out there. Almost everybody has it. So I think of it more of a side effect of being sexually active as opposed to something in that kind of typical STD category, if that makes sense.
Thank you for, enlightening us on that part. Because sometimes as patients, we get like overwhelmed actually with all the information.
Of
But
course.
I would like to add for our participants that a more in-depth review of the test results and everything will be discussed on a January 8th webinar. So you can go and register for it. It's going to be very interesting. We do have some questions or comments from our registrants. Um, One of them is from Carrie. She says to please comment on the current opinion of HPV screening with genotyping as primary without PAP. And we're bringing market HPV genotyping screening by urine by PCR.
Wow, that is a high
Okay.
level. Thank you, Carrie. So primary HPV testing, like I said earlier, is not available in every single center. It is recommended as a potential screening modality by the American Cancer Society. And in testing centers where you have that ability to do that testing, I think it's an excellent way to screen patients. The big things that I want to make sure at your center are available are it's a whole different set of testing compared to what we've been doing for many years with co-testing. So is the lab prepared for what to do with abnormal results for the HPV test? Do they know exactly when they're supposed to run the cells and look at the cells under the microscope, right? So if you're in a place that offers that, and you're a provider, it sounds like potentially make sure that you understand the sets of guidelines for what would need the cytology testing to be run, and then what combination of results you're going to see people for colposcopy. It's a good question. The urine testing and PCR testing, I'll be honest, I don't know enough about that to comment on that in a highly educated way. And I hope that these are things we're going to learn a lot more about as providers as this gets rolled out more nationally. So thank you for your question.
That's an interesting question, actually.
Yeah.
We also have one that I find very interesting. It said, should I get screening done when I'm on my period?
Great question.
Yeah.
Well, in a lot of circumstances, you can still have screening while you're on your period. It depends a little bit though, right? The doctor's always going to say it depends, right? If it's a very, very heavy flow or you tend to get very, very heavy periods, in some cases that can change the results or obscure the results and um, make the cells less difficult or more difficult for the pathologist to look at. So if it's a light period in general, that doesn't get in our way, but a heavy period potentially could. So if that's going on, call your healthcare provider, see what they recommend based on how heavy the flow is, see if they recommend rescheduling. But if it's light, kind of on the first day or the last day and it's light, absolutely fine to still have the screening. And we're gynecologists. We're used to seeing everything under the sun, so don't feel embarrassed by being on your period if you're getting a pap smear. We see that all the time. Don't worry.
Thank you for saying that because I guess sometimes I was scared of going when
Yeah,
something was abnormal.
of
Um,
course.
we have another question from Andrea. She says, can you have a PAP when you have a vaginal infection?
You can, yeah, you can. And if you are worried you have a vaginal infection, your provider could also do additional tests to look for that infection, determine what type of infection. You have those sorts of things can both be done during the same speculum exam, but it's not wrong to have a pap smear at the same time. Great question.
Um, there's another great question here. If I'm uncomfortable of doing self-testing, can my husband come with me to do the swab part instead of the doctor?
It's a good question. Right now, the FDA has approved it for truly self-collection by yourself and by no one else. So right now, as things stand, unlikely that that would be permissible by our guidelines. I wonder if something in the future might change about that, right? But right now it would be truly yourself. Yeah.
We do have another question. It says, what steps should I take if I'm experiencing abnormal symptoms such as irregular bleeding?
That's a great question. In terms of signs and symptoms of cervical cancer, and Carly, I don't know if you want to share a little bit from your story too, but sometimes a potential sign is abnormal or irregular bleeding between periods and pelvic pain, and sometimes funny discharge that smells different, or more discharge than you're used to having. If you're having any of those symptoms, important to go get checked out by a healthcare provider. They may do a number of things. They might do the pap test, an HPV test, and they might recommend other things depending on what they think is causing the bleeding, if that's your main symptom. They might do an internal exam to feel the ovaries and the uterus. They might look for other infections besides HPV. And they might do things like look at a pelvic ultrasound, as there's a number of things that could cause bleeding. But it's really important if you're having abnormal symptoms to be checked out by a healthcare provider for sure. And Carla, I don't know if you want to share a little bit about, the symptoms that brought you
Yeah.
in or.
Well, one of the symptoms, I actually went because of my thyroid cancer. I didn't even know it was thyroid
That's
cancer until
right.
after surgery. But one of the things that I found out after being educated and after my doctor explaining was abnormal bleeding after sex.
Right.
Um, I thought like, well, my period's coming soon. Maybe I would give it so many excuses to it, but I didn't actually know that that was one of the symptoms for it.
Absolutely.
And when I finally got to the gynecologist, said, yes, this is not normal. And when they did my testing, I bled also. So the bleeding was abnormal in the moment.
Yeah. Thank you for sharing that. Absolutely.
We have another one. What if someone is having abnormal symptoms, but is under the age of 21?
It's a good question. I think it all depends on what's going on, right? If you are sexually active with those symptoms, right? Sexual activity is really what transmits that virus, the vast majority of cases. So if you're under 21 and having those symptoms, talk to your healthcare provider. They will decide what tests might need to be done. Abnormal bleeding can be from a number of causes in that age group as well. And you can have a pap test under the age of 21 if your provider is worried about something with the cervix, but really depends on the particular scenario. So definitely talk to your provider and see what testing they think is needed and ask them specifically about a pap test too if you're concerned. Yeah.
Ah, that's fairly interesting that you can go before the age of 21.
It would be very rare.
Mhm.
Occasionally those cancers can form in younger patients, but very, very, very rarely. So you'd be more likely to be from another cause if you're having those symptoms, but still important to ask and advocate for yourself. Yeah.
We have one question. What specific considerations should individuals of the LGBTQ community be aware when it comes to cervical cancer screening, especially those that have a cervix?
Great question. So I think there are a lot of, things going around in the community saying that folks in same-sex partnerships don't need screening, and that's absolutely false. Anyone with a cervix, however they identify, sexual orientation or gender, needs a pap smear, definitely starting by age 25 or HPV test. And that's because you can still get the virus HPV even if you're not having penetrative intercourse or penile vaginal intercourse. It can even sometimes be transmitted from skin contact, not necessarily penetrative intercourse. So definitely folks in the LGBT community still need their screenings for sure. I will say, because of, those kind of myths about the community not needing this screening, that we definitely see higher rates of cervical cancers and precancers in the LGBT community. And so we see disparities in outcomes. And there are other disparities in terms of other groups that are less commonly getting screening. That's one of my research interests, is why we see differences in who's getting screened by race and ethnicity, socioeconomic status, and rural status, like you brought up earlier, Karla. So I think access is super, super important. I'm super excited for self-collection, and just very important for folks to get screened no matter how you're getting screened these days. Yeah.
I have a personal I have a question because I'm very much interested in the immunodeficiencies that
Mhm.
happen. And what happens if someone has HIV and wants to go to screening? Should they get the normal cervical PAPs or co-tests?
Yeah, it's a great question. So folks who have issues with their immune system are at higher risk, right, from this virus. This virus clears, on average, in most folks in about 2 years with a normal, healthy, functioning immune system. If you have HIV, your immune system doesn't work as well to fight the virus. And so the screening recommendations are a little bit different. Recommendations are to definitely start screening at age 21 to 25 for sure. And depending on the type of testing you're having, either a co-test, so both the PAP and HPD, or PAP alone. If you do a PAP alone in these folks with HIV, you need 3 annual tests to prove that they're okay to go longer screening intervals. And for a co-test, in general, it's still okay to do every 3-year testing, but these are people we watch very, very closely because they are high risk for developing precancers. Other people who have immunodeficiencies, so if you have like rheumatoid arthritis, for example, and are on some medicines that on purpose suppress your immune system, or other autoimmune conditions where you're on those sorts of medicines, your healthcare provider might also recommend more frequent screening for cervical cancer, just due to being more at risk of that virus hanging around and not clearing. Yeah.
Thanks for the answer.
Yeah.
Um, I have one here that says, what is my risk of getting cervical cancer if my mom had cervical cancer?
That is such an excellent question. So many different cancers are genetically linked, right? We think about even in the gynecologic organs, ovarian cancer, endometrial or uterine cancer, all of these things have genetic risk factors where if you had a mom or sister who had them, it's much more common that you would get it, just due to genes being passed down through families. Cervical cancer does not have a genetic link whatsoever. So because your mom had it does not necessarily mean that you are at higher risk of getting it. It means you definitely need your healthcare screenings and your PAP and HPV testing. But because we know like 95% plus of these cancers are caused by this virus, by kind of an environmental exposure, genetics does not seem to play a role in the vast majority of cervical cancers. So that's a really good question. I'm really glad someone asked that. That's
Yeah, that's a great question.
yeah.
Um, about the resources in the States, are there any resources that could help cover costs, or what would be the process for someone to go through it?
Great question. So finances, if you have health insurance of any variety, even if it's public health insurance, private health insurance, any variety, they absolutely cover the costs of these preventative screenings. For folks who don't have insurance or don't know if they have insurance, there are programs to help get screenings that are available at certain centers throughout the country. The National Breast and Cervical Cancer Early Detection Program is a program from the CDC where different healthcare centers sponsor people and allow them to get screenings at either low cost or no cost at all. And so I think we're going to put the link for that program in the chat if folks are interested. Um, thank you guys so much. And there's a button on that website that allows you to say, find a screening program near me. So there's definitely options. The other thing is, if you need help getting health insurance, if you think that you're a candidate but don't know how to get health insurance, patient navigation, patient navigators through a local health center is a fantastic resource. These are people whose whole job it is to help people navigate this complex healthcare system that we, live and operate within. And so they can really help a lot in terms of getting you insurance coverage if you're eligible, and those sorts of things too. Yeah.
Amazing. I know also that we can check out the cervical roundtable.org. So if you want to
Absolutely.
check, there are more resources that can help anyone out.
Perfect.
Um, we have here, can someone who has had HPV in the past still get the HPV vaccine? Is that recommended?
Great question. So the HPV vaccine works best when we give it to folks before they've been exposed to the virus. So nowadays, most of the time we're offering it to kids in the 9 to 11 age group because that's the group it works best in, far before any sexual activity. It's technically approved, the HPV vaccine, up to the age of 45. So you can definitely still receive it up through age 45. It is less effective the older you get and if you've been exposed to the virus before. They're actively looking and doing research into, for folks who have a precancer, is it helpful to get the vaccine? The jury's kind of still out on that, but the younger you are, the better to get the vaccine is the take home, and certainly not harmful to get it up to age 45, but maybe less effective as we age. Yeah.
Um, should a woman still be getting a pelvic exam in the years between the pap tests?
Good question. So, a lot of times people come into the doctor and it's hard to know, when do you just have a pelvic exam versus when did the pap test occur too. People end up in my office, which is a place where I see people with pap abnormalities almost exclusively. And it's really hard to know sometimes, did I have a pap test with that pelvic exam or was it just a pelvic exam? Reason being, we should have a pelvic exam generally every year or so, even if we're not getting a pap or HPV test. The reason is there are a lot of other things your provider is looking for on that pelvic exam besides just cervical cancer screening. They are in general looking at the vagina as well, looking for discharge signs of infection. They're looking at the vulva, which is the skin on the outside, to look for changes. And then they often do that sort of internal exam to feel the uterus, feel the ovaries, make sure that they don't feel any abnormalities. So those parts of regular preventive care are still important between your pap tests. And in general, we still recommend seeing a provider between those pap tests for a pelvic exam every year, every 2 years, at least, on a fairly regular basis to have those checks.
We have another question
Sure.
that is getting the two tests co-testing better than getting one?
It's a good question. Depends which one you're getting. It seems like the HPV test, if you were to choose just one test to get, the HPV test is a better one test to get. The pap test by itself, it's pretty good, but when we do them both together, honestly, it works very, very well to tell us what's going on. And eventually we're going to move to this system, like I mentioned, primary HPV screening, where everybody gets an HPV test. And then only if the HPV test is positive do the folks look at the cells. So complicated question, but right now all centers are really offering that co-testing, which works very, very well. And some centers are offering that one HPV test first, and then looking at the cells later if it's positive. Yeah.
Um, we do have one more from Lori. She says that on the question of genetics, I know it said it's not found in DNA, but what if multiple family members have been treated for pre-cervical and stage cervical cancer? Could it be possible that some family members have difficulties clearing the virus? And that was her experience.
Yeah, gotcha. It's a really good question. There are those 5% of cancers that are caused not by HPV, right? There are some very, very rare types of cervical cancer that could have a genetic link. And I would say if you're worried about that, bring it up to your healthcare provider for sure. There's very, very rare scenarios, but these things can happen. I would say it's very much not the norm. Um, so I would encourage you to talk to your healthcare provider about your unique situation and express your concerns and see if they think genetic testing could be right for you.
Oh, I think we don't have any more open questions. These were such great questions. I've learned so much today.
They were great questions, yes. And
Yeah.
thanks for all your questions too, Karla. They're fantastic.
This was amazing. I don't know if anyone has any other questions or you would like to add something else.
I think just the big thing I want to empower everyone in this chat to do is really feel like you can advocate for your own health, ask the questions you need to ask, and talk to your healthcare providers about your concerns. If you're worried about cervical cancer, get screened, do it early, do it often. And if folks have ongoing questions, the folks at the American Cancer Society have excellent resources on their website to help you learn more, and the upcoming webinar in January to learn about kind of what happens when you have a positive test.
Thank you so much. I also want to thank you all for joining us for our webinar, Screening and Early Detection of HPV and Understanding Your Options. A very special thank you to our guest, Dr. Stephanie Alimena from Brigham, did I pronounce that right? Women's Hospital, and for sharing your invaluable expertise and insights on this super important topic. As we discussed, HPV is a virus linked to cervical cancer. Be proactive about your cervical health by familiarizing yourself with various tests available, including the PAP and the HPV test, as well as the benefits of post-testing and self-collection options. As a reminder, January is Cervical Cancer Awareness Month, and an ideal time to start these conversations with your healthcare provider about getting screened. If you have concerns about the cause or experience any abnormal symptoms, there are resources available, including the cervicalroundtable.org. So you can link on that. And I know that in the chat, they have placed other resources. We encourage you to register for our January 8th webinar, Understanding Your HPV Test Results, for a deeper dive into interpreting your test results. We truly appreciate your participation, and I'm looking forward to seeing you next time. Thank you, Dr. Alimena.
Thank you so much, Karla. Really appreciate you being here, sharing your story, and I'm so thrilled to be a part of it. So.